The following video is a compilation of highlights from a question and answer session between Advanced Bioservices OrthoGlide medial knee implant patients and orthopedic surgeons. Patient number 1 is an 82-year-old male who has been living with the OrthoGlide implant for 4 years and 9 months. Patient number 2 is a 69-year-old female who has been living with the OrthoGlide implant for 5 years and 7 months.
So you just had the one knee?
Yeah.
And that's doing really well?
Very, very well.
Okay.
Very,
That's
very
been in since?
February of 2007.
2007.
5 years.
5 years.
5.5 years.
Yeah.
Okay.
So, do you get any swelling in the operated joint?
And this one, no.
Do you wear any support,
No.
knee support, anything?
How long did it take before you were to the point where you were pain-free as you are now?
Dr. Markman will tell you that, I had told him it was painful to start, and I'm sure it was. I remember I couldn't even put my shoes on.
They said, I remember him saying that you had pain at least up to 6 months and maybe a year.
Yeah.
It got gradually better,
Right.
but then I think he said about a year, the pain all went away.
Yeah.
How often you had to pop pills to control your pain for 6 weeks?
They gave me Darvocet, and I think after maybe 6 weeks, a month, and then it just tapered off.
It's got better slowly.
Yeah.
Did you ice your joint? Ice your knee?
Oh, yeah. I forgot about that, but I iced a lot.
That's the key.
I did too. I think I was, I had pain, and I would call it manageable pain, for a year.
Okay.
So I never took any pain medication for that knee.
Yeah.
Heavens.
And pain wasn't too bad. Like I say, it was manageable. And then after a year, it just diminished and went away.
And what was the perceptible difference you had pre-surgery? You had your painful knee.
Oh, yeah.
And after 5 days of the surgery, what was your experience with that standing pain which you had in arthritis? Was it better? Walking pain was improved?
Well, 5 days after, you'd still have that big thing on your leg.
But see, that's a surgical pain, what you'll have after week, 10 days or second day. But the pain which you had before the surgery on standing, that must be improved dramatically.
Yeah.
That usually is our experience too.
Yeah.
That they tell us that pain is not there. Right now I'm just feeling the cut,
The pain where
surgery pain of the surgery. So I think it matches what our experience is. And probably we are in a very still early phase of the surgery in India. But I think we'll follow the same problem.
But you should just tell your patients not to wait too long.
Yeah, that's what we always advocate.
Yeah.
I think that's
That's real important for this type of implant.
exactly. Because I think you have to have a little cartilage. Am I understanding that right? You have to have a little
right?
cartilage left in order to do it.
Did you have to change what you did after you had the surgery? You were still on the treadmill?
No.
Or you...
I have done the treadmill since I met Dr. Mark.
Okay.
I got a bike, a stationary bike, and a regular bike.
That's the best.
Yeah, that's the best. It takes the weight off the knee and
Yeah,
it still
and
exercises.
just the last years, 18 months, I've walked again,
Sure.
I mean, I can't run, but I do walk, because the other one, is not 100%.
You need to run anyways. You need to walk without pain, that's it.
Right, and I have no pain.
Like you shop, you do your parties or your social activities, you travel without pain, that's what you want.
Yeah, I'm just 100% for it. And he even said that if this one went out, that he could put another one in.
Yeah.
So, I mean, our goal, his and my goal, is that I never have to have knee replacement.
That's what we also looking forward to. That can we prevent any replacement after the surgery? That's what we are looking at.
Yeah. But I did like 6 weeks of therapy afterwards.
That's nice that you need it.
Yeah. I mean, I was real faithful to that. I went back to work, I think, in 3 weeks. Yeah. Well, I retired in 2008, and then a year ago I went back just 2 days ago. It's perfect. So.
And how much difference to your life after the surgery?
Well, I'm a skier.
Okay.
And I skied annually in Montana for many years. We'd go in February to Bozeman and ski for maybe 4 or 5 days. Now in 2007, we went to Bozeman and I was going to ski for 4 days, and after the first day I couldn't ski anymore. Every left turn I would make, my knee hurt so very much. So I knew I had to have something done. And so then in December of that year, I got the implant. As a matter of fact, I was skiing, this time in Colorado, a year ago last February it was, in 2011.
So how long were you able to ski then?
I skied 3 days.
You did?
Because that was the plan.
Wow. So you did it without a lot of pain then, huh?
Yes. Yeah, it didn't bother me.
Oh, amazing. When did you get to the point where you felt you could ski again? And you skied after 4 years after your surgery. Were you able to ski any sooner than that? Oh, that's just amazing to me.
I put the skiing on the back burner. I didn't think much about it.
Yeah.
For a few years after I had the surgery. In those intervening years, I had a farm, and I was farming 4 days a week, sometimes 5. I would be at the farm doing a lot of things.
Sure.
What type of activities were you able to perform on the farm after the surgery? Like, how strenuous and for how long of a period of time?
Not real strenuous. I did an awful lot of walking around.
Okay.
And up and down, up on a tractor and down again, and
It's not easy.
repair work. Horses are
Demanding.
hard on equipment, and either chew the stalls or kick them down, and so it was that kind of repair work went on. And that takes some knee activity.
Oh, yeah.
Are you still happy with the knees?
Oh, heavens, yes. Okay.
We're poster children.